long should you schedule a new patient initial appointment? What's the right answer? What's the best way to do it? Well, that's what I want to talk about in this week's tip. All right, so how long should you schedule new patient initials for? Well, there really is no right answer. I know you could probably click the video off now, right? There are two different ways people normally do it. If I survey a room full of dentists here at an MGE seminar, I will hear one of two answers when I ask, how long do you schedule new patient initials for? I'll hear 1 hour, and I'll hear an hour and a half. 1 hour is more common. And we're talking adult new patient initial, not a kid, right? An hour is more common than an hour and a half. There's also the other factor is, are you running these new patient initials through hygiene or directly into the doctor's schedule? Again, that's a personal preference. There's no right or wrong answer. The stuff I'm going to be talking about today apply to both. But let's talk about the hour versus the hour and a half. So what happens in the average 1 hour new patient initial appointment? Let's say it goes through hygiene. Period probing, scans, etc. But at some point the doctor is going to have to come in and do an exam. Same thing if it's in the doctor's chair. Even if you have the assistant taking the x-rays, at some point you're going to have to come in and do the exam in that 1 hour appointment. So what are the pros? People are used to doing it. It's very efficient. If the patient doesn't show, it's not as big of a hit to the practice. It's only 1 hour. But what are the cons of this appointment? Let's say it's a patient who has a larger treatment plan. You've got them in hygiene. In the first 40 minutes, the hygienist is doing everything that the hygienist does. You now have 20 minutes that you're going to bump in there and do your exam. Well, after meeting the patient and getting to know them for a minute and doing their exam, 15 minutes have passed. You now have 5 minutes, and this patient needs $10,000 to $12,000 worth of treatment. The biggest mistake you can make at that point is try to present that $15,000 treatment plan in 5 minutes. You're probably not going to, you're going to do it. They're going to go off to the treatment coordinator. You're going to ask what happened later and hear that they wanted to think about it. It wasn't enough time to close, okay? That's a problem. And we've talked about that repetitively here on our channel. Always make sure you have time to sell. So that's the con of the 60-minute. What are the pros and cons of the 90-minute? Pros are, obviously you have more time, or usually the same amount of time is spent on diagnostics, but that last half hour is baked in case there's going to be some type of a treatment conversation. Sometimes there's more time baked in order to get to know the patient a little better, because how exams and new patient initials are done really do vary office to office. I've seen people eat up the whole hour and a half just getting to know the patient and doing diagnostics. But in many cases, if the patient does need extensive treatment, you'll have a little bit of time baked into that appointment to actually present that treatment plan. So that's good, okay? So that's the pros. What are the cons? If an hour and a half appointment blows off, that's a much bigger hit than a 1 hour appointment. And then I have a kind of a weird or a unique con to throw out to you here, which is, let's say for that 1 hour new patient initial, I don't have time to present today. I only have 5 minutes left in the appointment after doing my exam, and I'm gonna have to bring the patient back for the presentation. Well, I have time at that point to see, do they need to bring anybody else with them who's part of the decision-making process? Let's say it's my patient, Joe, and I say, Joe, I'm gonna bring you back for a consultation, day after tomorrow at 8 o'clock. We're gonna go over everything I found today. Is anybody else normally involved in making healthcare decisions in your family? Joe might go, well, yeah, my wife usually wants to know about things like that. Okay, great. Can we bring your wife with you? Or can you bring your wife with you so I can explain the treatment plan to both of you at the same time? You can have both decision makers there. In the 90-minute appointment, if I had Joe there, sure, I've done all his diagnostics. I have a half hour to actually explain the treatment plan. But at the end, he may come out with, oh, doc, this sounds great, but I'm gonna have to talk to my wife. Okay, and in some cases, I want to talk to my spouse is a great objection, where in some cases it's legitimate, in some cases it's a way to get you to leave them alone. It's basic sales resistance. It's a tricky objection to deal with. You may have to talk to Joe's wife and explain to Joe's wife exactly what you found. Now, with the advent of technology, with things like Zoom, assuming that how you're doing it is HIPAA compliant, that's a lot better. You might have a phone call with Joe's wife or a little conference with Joe's wife, or you might set up another appointment for Joe to bring his wife back and explain it again. Up to you how you want to do that. But that's one of the cons of the 90-minute appointment. The other con of the 90-minute appointment is, let's say the person needs little to no work, and you spent that full hour doing your normal thing, and now you get to the end you get the last half hour, and there's really nothing to talk to the patient about because they're fine. So here's what we normally recommend to a client. I recommend a hybrid approach. because we have the hour appointment and we have the hour-and-a-half appointment. Whether you're putting it on the doctor's schedule or the hygienist schedule, it doesn't matter because, again, the doctor is doing an exam. And this all comes back to this hybrid approach, your intake form when a new patient calls in for the first time. So if you're gonna do what I'm recommending, you have to make sure whoever is scheduling your new patients is on the ball, because if they're not, they can mess this up real bad. But if your intake form is good, and I'll give you a sample intake form in the video description below you can download for free. It's from our online platform, DDS Success. But if your intake form is good, you're gonna get a bit of information from the patient to understand what's going on so that you can decide, if you're the person scheduling, whether this person should come in for an hour or whether this person should come in for an hour and a half. Because it's gonna have questions like, when was the last time you saw a dentist? Did that dentist recommend any treatment? Did you do it? Are you having any particular problems right now? Is there anything you wanna talk to the doctor about in particular? I'm asking these questions because I'm trying to find out what's going on with the patient. So let's say I have a patient call in, they're 45 years old, and I ask them questions. When's the last time you were at the dentist? It was 4 years ago. Did that doctor recommend any treatment? Yeah, I'm missing 3 teeth. They said I should get some implants. They also said I needed a crown. Is there anything you want to talk to the doctor about when you're here? Yeah, a couple teeth in the back of my mouth really hurt. Okay, so this is probably not going to be a small case. That patient gets an hour and a half. Versus I get somebody who calls in, they're a college student, they don't live here, they're here going to school, and they see the dentist every 6 months, they're just an excellent compliant patient, and I ask those questions. No, my dentist said I had the cleanest teeth ever, I don't have any cavities, had a cavity once, blah. They're getting an hour, okay? Now, and specifically, I would rather, okay, if I'm gonna mess this up, I would rather they scheduled people for an hour who needed an hour and a half than scheduling somebody for an hour and a half who really needed an hour, if that makes sense. So that college student, I would much rather have them get the hour, which they're supposed to, but let's say the person who had all those missing teeth, I'd rather they got the hour and bring them back for a consultation than for the college student to get the hour and a half, and at the end of the hour exam, they're getting their prophy nail, I have nothing to do. So that's what I recommend, is have both of those things at your disposal, the hour appointment, the hour and a half appointment, and you deploy it based on whoever's handling these calls. They have to be able to do it well based on the situation they're finding with the patient. That it makes things easier, it bakes time in to actually sell the case when there's a high probability that the patient is gonna need treatment. And worst case scenario, if a patient who has extensive treatment ends up coming in for an hour, you can always bring them back for a consultation. Anyway, that's all I have for you on this one. I do hope that it helps. If you want to find out more about MGE, you can find us online at mgeonline.com or call us at 800-640-1140. If you'd like to see more tips like this, don't forget to click the subscribe button and the notification bell. You'll get a notification as the next tips come out. Folks, have a great week. We will see you at the next tip.